Here is a video on face treatment vectors. We know we have completed the super passes for this cosmetic zone because we have reached clinical endpoint. As you can see, there is visible erythema, the skin feels warm to touch, and there is a palpable change compared to the untreated side. You can also see the treated side is visibly tighter. We can now move on to vectoring. When vectoring, we vector just under the zygomatic, followed by traveling along the nasolabial and above the mandible, then the submentum, and finally under the jawline. This is how we vector. Ensure you apply coupling fluid, hold the skin and begin the first rep. As you can see, we are following the zygomatic bone, not the grid. Ensure that there is no overlapping, all 4 points of the tip are in contact with the skin, and the handpiece is perpendicular. This is one pass on the vector. You will complete up to 5 vector passes in a row, always assessing for clinical endpoint. Ensure to ask for the patient feedback and monitor their body language. Here is the third pass over our first vector. Now our fourth pass over the first vector. This is the final pass of the first vector. Our second vector will be down the nasolabial line and across the mandible towards the ear. Ensure that the first rep of the second vector is lower than the first vector to avoid overlap. Remember to reapply a generous amount of coupling fluid. Holding the skin in the direction of the desired contraction, begin your second set of vector passes. Again, you are not following the grid, but rather the contour of the face. It is critical whenever you are delivering a Thermage treatment to continually ask your patient how much heat and discomfort they feel at the treatment site. Your patient should feel that the treatment is hot, just starting to feel uncomfortable, but easily tolerable. If it is too hot, then please reduce the treatment level. If the patient feels nothing or feels that the treatment is very comfortable, you can increase the treatment level. We have now completed the second set of vector passes. Our final vector will be the submentum traveling along the jawline. Position the patient to gain as much extension as possible. This helps ensure good tip-to-skin contact. As always, apply a generous amount of coupling fluid. Ensure the handpiece is perpendicular to the skin and all 4 points of the tip are in contact with the skin, and begin the final vector. Again, we are not necessarily following the grid for the vector pass. We are ensuring that there is no overlap of pulses. We're now completing the passes for the final vector. Remember to apply coupling fluid before each pass.